to be having. I'll come to GE. GE has multiple businesses. We are one of them, GE Healthcare. And interestingly, our mission is to reimagine healthcare. So what we are saying is, from late disease treatment, from measuring information, from measuring lifespan, not very clear on the quality and cost, and from inequality in healthcare access, we are now trying to move into a focus on early health, talking about insight, measuring health span vis-a-vis lifespan, transparent quality and cost, and equity in healthcare access. Now what we say is, predict, diagnose, treat and monitor, all these revolve around one common nodal point, which is inform, and that is where healthcare IT plays a key part. So we have multiple products across enterprise, imaging, business, e-health. Another representation of the same product portfolio. So on the bottom there is your basic HIS, hospital information system. What is shown in red is the departmental solutions, your lab, pharmacy, perinatal, OT, radiology, ICUs. Then you have little bit advanced clinicals, and at the top you have data integration, which is your health information exchange or your health information network. So what we are saying is, you should be able to create data, share that data, manage that data, and apply that data. Now, who are the people who create the data? These are the physicians, the hospitals, the labs, the pharma, the payers, and these are going into a second level where it is shared across a health information exchange. Who manage it? You have clinical portal where the providers can manage it, and you have a patient portal where the patient has control over data which is held on his name across the enterprise. And then you come to the top layer where you have the value add for e-health solutions. I take this opportunity to welcome you to our stall. We have a stall here where me and my colleagues are very happy to walk you through some of the products that we have for India. So we have products for imaging, we have products for data. Our imaging products cater to the PAC and the risk markets, and the critical care areas, including all intensive care unit, coronary care unit, neonatal ICUs, medical ICU, surgical ICU, all of them put together, we call it the critical care area. And then we have a product for the perioperative area. We have two variations of that. We have an anesthesia which is used by the anesthetist, and we have a manager which is used by the administrator of the operation theaters. Centricity PACS is a premier web-based PACS. The product name is PACS IW. It's got advanced 3D visualization. It's a standards-based, highly scalable solution. RISI, this is used for doing the workflows in the radiology department. Teleradiology Exchange, a new concept where an image exchange platform with advanced clinical capabilities to enable teleradiology. Graphical representation, how across a data center, hospital, diagnostic center, and using the web technologies, this data is shared. Coming to the critical care product, care forms today in ICU is the same story what I started with. It's like a huge running sheet on which color is used and symbols are used to jot down numbers, and many of these numbers, as I mentioned, were duplicates or repeated more than once. So when you convert it to electronic format, this is how clean and crisp it can look. And few other things which I would like to highlight is, you have HL7 connection to devices, you have your HIS and your LIS connectivity, so it can take data from the hospital information system. It can also pick up data from the lab information system. You have dynamic user-defined viewing intervals, one-click trending. Whatever that value red stands for is clear that there is a dip. So as a clinician, you don't have to walk through each line of data. You can take a look at it using the trending feature. Fluid totaling, which is actually something which every shift and every day has to be done manually, is automatically done here. So the box which is highlighted shows you the first shift, second shift, third shift totaling, and the auto totaling for the day. This is a technical diagram showing how all devices can be connected to our product. So we have GE devices on the left side, we have Datex Omeda devices in the middle, and we have the non-GE devices on the right side. So basically all devices can connect via gateways to the system, thereby bringing in data. And what are the machines which are connecting? You have bedside monitors, you have ventilators, you have anesthesia machines which can connect and pump data directly to the system. A little bit about Centricity perioperative product. This is how it looks in the operation theater when it is installed and used. And on the right side is in the recovery room. So this is a product which manages a full breadth of operative care, scheduling to discharge. And the anesthesia product is a documentation system for anesthetists. So it gives you accurate, clear clinical documentation easily created at the end of procedure. Some screenshots showing you the product itself. On the top left side is what we call the anesthesia cockpit. This is actually what the anesthetist uses when he is using the product. And on the right side, not too sure if you can see it, but that is the lab data which is coming in from the labs into the system. And this is color coding to show different areas inside the theater. And that the lower one on the right side is your history and physical examination, which the anesthetist does when he does his assessment. A little bit more elaborate view of the anesthesia cockpit itself. So the buttons are big because you don't expect anybody to use a mouse in the theater. It's supposed to be on a touch screen. And you have the anesthesia care plans which are like preset pathways. So when the patient is on anesthesia, if he develops malignant hyperthermia, which is a very serious condition, the patient's temperature starts going up to very dangerous levels, then this kicks up, and then so you can standardize how anesthetist will manage the malignant hyperthermia using this pathway. And this path, like this other pathways also are available which can be built and used. Now Centricity Perioperative Manager, it helps you to increase utilization of theater, personnel and equipments. It tracks everything from materials, transplants, implants, inventory management, and it is a digital dashboard for anesthetist, surgeon and the management to track theater utilization. So what does it do? It increases your optimization and resource planning needs for the theater. This is a screenshot of your resource management, all the theater inventory which is used to manage theaters. Now remember, this is for an enterprise, so it would really be very good for somebody to run many theaters using the system. You have charge management integration. This is the case scheduling screen. It uses an intelligent algorithm to schedule cases. So availability of the surgeon, availability of the rooms, and the next available dates, all of them with color coding, it comes up. This is the tracker, wherein as the cases evolve, it could be viewed by the HOD of anesthesia, HOD of the surgery department. So the hash screens on the yellow actually show that that procedure has gone beyond time. So people are aware that this case has gone. So if there are cases, in the end, that needs to get rescheduled to another time. This is doctor preference cards. So depending on the surgeon, on the equipment he uses and his preferences, there's a photograph which shows the way he wants the equipment to be laid out and what are the equipment, how it needs to be set up, everything set up. And once that surgeon is pulled into the surgery, the doctor preference card also gets populated. Just to show you some of our customers, we have customers across India, and this is what we are aiming at. So data from your existing systems, evidence-based best practices should be able to provide you with a clinical knowledge platform. Thank you.